Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Anderson. I understand you're here to discuss your daughter, Emma?
Yes, that's correct. Emma is 8 years old, and I wanted to have a chat with you before I bring her in.
Certainly that's understandable. What concerns do you have?
It's about her eating habits. She has a strange approach to food, I must say. She will eat, but only certain foods, and she needs them prepared in a very specific way. I mean, it's more than just being a picky eater. She also complains about stomach aches a lot, which I initially attributed to her limited diet.
I see. Are there any other symptoms or behaviors that are concerning you?
Well, she doesn't seem to be losing weight, and she doesn't look ill, but she's also very precise about how things are arranged in her room. She gets upset if anything is out of place. It's just a lot of rigidity in her behaviors, I suppose.
Do you remember when these behaviors began?
It's been a while, a few months at least. I tried to think it was just a phase, but it's become more pronounced over time. I've also noticed that her behavior worsens when we have visitors or when she's stressed.
And have you tried any interventions or treatments?
We started with consulting a nutritionist to ensure that she's getting a balanced diet, but it didn't help much with her specific eating patterns. We also consulted a child psychologist who suggested techniques for stress management. They have been somewhat helpful, but not entirely.
What can you tell me about Emma in general? How is she doing in other areas of her life?
Well, she's doing pretty well at school, academically, but her teachers have mentioned that she's quite reserved, and she doesn't like changes in routine. For instance, if a class is rescheduled or there's a substitute teacher, she gets upset.
So she struggles with changes in routine, correct?
Yes, exactly. And her anxiety seems to be growing. Now, if she thinks her clothes have been touched by someone else, she refuses to wear them. It's becoming really challenging.
What are your main concerns then?
Well, I've been doing some reading and I'm worried that she could be showing signs of OCD or perhaps a condition on the autism spectrum. What I want to know is, what are the next steps for us?
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mr. Jones. According to your medical record, you've been dealing with a number of health issues recently. Would you care to elaborate on what you've been experiencing, particularly any symptoms that have caused concern?
Well, doctor, there's quite a bit going on. I've always been fairly fit, but I've been feeling really weak and tired of late. I'm also not feeling very hungry these days, which is strange for me. When I do eat, I feel full quickly, and sometimes I find it tough to swallow.
I see. Have there been any changes in your bowel movements?
Yes, there have been changes. Sometimes I need to run to the bathroom urgently. My stool has also changed color. It's lighter than it used to be, and it's often runny, and I feel bloated, like there's always gas in my stomach.
Noted. Any other symptoms you've noticed?
My eyes seem to have a yellowish tint, and my skin looks the same. I've also been experiencing a lot of itchiness, which is irritating, and I'm constantly feeling drained, just tired all the time.
Have you been experiencing any pain, maybe in your joints or elsewhere?
My joints seem to be fine, but I have this constant pain in my abdomen, and it wraps around to my back. It's worse when I lie down, and I often struggle to sleep because of it. I used to take antacids thinking it was heartburn, but it didn't help, so I stopped. I should have probably changed my diet. I'm a big fan of fatty foods, but not much for sweets.
And how has this been affecting your daily life? You're still working as a...
No, I retired recently. I worked in a chemical plant for over 30 years as a process technician. It was a demanding job with a lot of responsibility, and well, it could be quite stressful at times.
I see. What about your habits? Do you smoke or drink?
I smoked heavily, about a pack a day, but I quit when I retired a few years back. I still enjoy a beer or two during the weekends, though.
That's good that you've quit smoking. Did you quit due to health concerns?
Yes, a couple of years ago, I had hepatitis C. I decided to quit smoking thinking it wasn't doing me any good. Then last year, I was diagnosed with gallstones, which was quite a shock.
I can understand that. How have you been since then?
Honestly, things have been rough. I had a blood clot in my leg about half a year ago, which led to me taking warfarin. And then, to top it all, last month I was diagnosed with type 2 diabetes. That really caught me off guard.
I can see that you've had quite a challenging year. Now, what I would like to do is order some tests to help us get to the bottom of this.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've noticed you've switched to more plant-based foods. How is that going for you?
Well, I'm struggling with protein intake, I think. I can't eat much.
Is that a concern for you?
No, not really. I just don't feel the need to eat much.
What about your digestion? You've been consuming a lot of fiber. Is that causing any discomfort?
I've been feeling a little gassy, yes. I try to balance it with some antacids, but the bloating persists.
That sounds quite uncomfortable.
Yeah, it's a bit more than just mild discomfort.
In that case, I believe we should revisit your dietary plan. Perhaps we can adjust the fiber content and see if that makes a difference.
That sounds like a good idea.
Now look at question 26.
Good afternoon. How can I assist you today?
Hi, I've been experiencing back pain. I have osteoporosis, but it's more than just that. It's my lower back.
Has this been an issue previously?
Yes, it seems to get worse when I'm under pressure. I have been dealing with some stress lately. I typically do some light stretches, but I'm cautious because I don't want to make it worse given my condition.
Of course, it's good to be careful with osteoporosis. However, right exercises and stretches can actually improve your condition. You are correct, though, that managing the underlying stress could be beneficial. Have you considered seeing a mental health professional about your stress?
I did have a few sessions with a counselor once, but it didn't seem to have much of an impact.
I see. It might be worth revisiting that approach, or perhaps trying a different type of therapy, as chronic stress can often exacerbate physical ailments.
Okay, you're probably right. Thanks for your advice.
Now look at question 27.
So, are you open to trying a new exercise regimen for your heart condition? This would involve 30 minutes of moderate intensity activity, 5 days a week.
Oh, that's quite a commitment.
It's a bit of an adjustment, yes, but it can significantly improve your heart health. You would focus on cardio exercises, like walking or cycling. The payoff could be a substantial reduction in your heart disease risk.
Well, it sounds like a solid plan, and if there's a chance of improving my heart health, I guess I should give it a try. I just hope it's worth the effort. There's no guarantee it will entirely prevent a heart event, is there?
It's true that nothing can completely eliminate the risk, but exercise has been proven to greatly reduce it. We wouldn't suggest it if we didn't believe it would significantly help.
Now look at question 28.
You mentioned the risk of patients developing Parkinson's disease. What signs should I be looking for?
It's vital to know the official guidelines, but bear in mind that in reality, the diagnosis is complex. Tremors are a common sign, but patients may not always exhibit them, or the tremors might be subtle or attributed to other factors. Perhaps the patient has a slow gait, stiffness, or trouble with balance. If you suspect Parkinson's in a patient, refer them for a thorough neurological evaluation. Remember, early detection allows for better management of symptoms. We should ensure regular neurological evaluations and set up the proper therapeutic interventions, as well as organize prescriptions they'll need after diagnosis.
Now look at question 29.
So, Mr. Anderson, after reviewing the results from your recent hearing test, it appears there has been some improvement.
Well, it's not perfect, but there's less buzzing and ringing in my ears. That's such a relief. I could barely focus on conversations initially. I'm still not confident in crowded places, though. And I know I've lost some range of high-frequency sounds. Everything seems muffled. I notice it when I try to listen to music.
Your observations match our findings, and what you're experiencing is quite normal. Even though your hearing has improved to a certain extent, there will be permanent changes in the cochlea. Instead of perfectly capturing all frequencies, it will remain somewhat impaired, which would explain your symptoms.
Well, at least I'm able to understand conversations better than before. I'm grateful for that.
Now look at question 30.
As you know, many of our outpatients struggle to use their prescribed inhalers for asthma, so we've explored the reasons behind unintentional non-adherence. We discovered that one key reason patients forget to use their inhalers is due to the complexity of managing multiple doses. Unfortunately, we can't reduce the dosage, but implementing something as simple as breath testing to monitor patients is proving to be an effective intervention. The results of our trials show that over 50% of patients undergoing breath testing became completely adherent to their inhaler usage, leading to better outcomes. This is a significant breakthrough, considering that previous studies showed limited benefits for high-risk patients from complex and costly alternatives aimed at reducing rates of asthma attacks and hospital admissions.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
My name is Dr. Jane Finn, and as a microbiologist, I find myself regularly drawn into conversations about a variety of health-related topics. Today, I'd like to discuss an issue that's become increasingly prominent in our society: the rise of chronic diseases and the impact on our healthcare systems. In recent decades, we've seen an alarming increase in chronic diseases, such as diabetes, heart disease, cancer, and respiratory diseases. These conditions have a tremendous impact on individual lives, not to mention the broader healthcare system. They require long-term management and care, which can put a significant strain on health resources. In the 2 decades leading up to 2020, chronic disease prevalence worldwide surged by an astounding 40%. Much of this increase can be attributed to changes in our lifestyles. As our societies have become more sedentary and our diets have shifted towards processed high-calorie foods, we've seen a corresponding rise in chronic health conditions. Even as we are experiencing this rise in chronic disease prevalence, there is a persistent belief among some individuals that medical intervention can solve all their health problems. Many patients expect their doctors to provide a pill for every pain, a remedy for every symptom. Yet, when it comes to chronic disease management, this approach often falls short. In the UK, for example, over the last 5 years, we have seen a slight decrease in the number of patients receiving prescription medications for chronic diseases. At first glance, this might seem worrying. However, data indicates that this reduction hasn't adversely affected patient outcomes. Indeed, the focus of chronic disease management is gradually shifting from treating symptoms to addressing root causes and promoting healthier lifestyles. The need for a holistic approach to chronic disease management has been highlighted by a recent research paper. It found that comprehensive lifestyle changes, including diet, exercise, stress management, and social support, can often be as effective as medication in managing chronic diseases. However, the media response to this paper has been somewhat misguided, suggesting that patients can simply replace medication with lifestyle changes. It's crucial to emphasize that this is not a one-size-fits-all solution, and medical advice must always be sought. Take, for instance, diabetes, a chronic disease affecting millions worldwide. The link between diet, physical activity, and the development of diabetes is well documented. And while lifestyle modifications are critical in managing this condition, they aren't a substitute for medical treatment in severe cases. The healthcare sector has also been grappling with the use of medications in the management of chronic diseases. For instance, opioids have been widely prescribed for chronic pain, leading to an opioid crisis in many parts of the world. This serves as a stark reminder of the risks associated with over-reliance on medication for chronic disease management. As we tackle these challenges, we are also exploring innovative ways to manage chronic diseases. From the use of technology like health monitoring apps and telemedicine, to the development of targeted therapies based on genetic information, there is hope for more personalized and effective care in the future. To conclude, while the rise in chronic diseases presents a significant challenge, it also offers an opportunity to rethink our approach to healthcare. By focusing more on prevention and lifestyle modification and using medication wisely and appropriately, we can provide better care for individuals and ease the burden on our healthcare systems. Now, before I move on to
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, I'm James Morrison. I'm an endocrinologist, and today I'd like to discuss with you a health issue that impacts over 34 million people in the United States alone: diabetes. Diabetes is a disease that occurs when your blood glucose or blood sugar is too high. It can affect different parts of the body, most notably the heart, kidneys, eyes, and nerves. When I was in medical school, many people believed that diabetes was simply a disease of the pancreas. And once you were diagnosed, there wasn't much you could do other than manage it with insulin injections. That was a half-truth. Yes, insulin is crucial in controlling blood glucose levels, but it is not the only strategy. Diet, exercise, and maintaining a healthy weight are just as important. Another common myth is that diabetes is caused by consuming too much sugar. While a diet high in sugar can contribute to the development of type 2 diabetes by leading to obesity, it is not the sole cause. Sedentary lifestyle, genetics, and age are also significant risk factors. Moreover, type 1 diabetes is an autoimmune condition, and its onset has nothing to do with diet or lifestyle. Some might think that physical activity could be harmful for people with diabetes because it could cause low blood sugar. In reality, regular exercise helps improve blood sugar control, promotes weight loss, reduces heart disease risk, and boosts overall fitness. It's a vital part of diabetes management. However, monitoring blood sugar before and after exercise is essential, especially for those on insulin, to prevent hypoglycemia. Then there's the misconception that if you have diabetes, you can't participate in demanding physical activities. While it's true that managing diabetes requires careful planning, it doesn't mean you can't engage in strenuous activities. With the right preparation and management, people with diabetes can climb mountains, run marathons, or do virtually any physical activity they enjoy. Now let's talk about diagnosis. We use several tests to detect diabetes, including fasting blood sugar test, oral glucose tolerance test, random blood sugar test, and A1C test. An A1C test in particular can tell us the average level of blood sugar over the past 2 to 3 months, providing a broader picture of blood sugar control. Often, patients want to know if there's a cure for diabetes. Currently, there isn't a cure, but we have made significant advancements in managing the condition. Aside from insulin therapy for type 1 diabetes, we have a variety of medications for type 2 diabetes that work in different ways to lower blood glucose levels. And excitingly, we're making strides in the area of islet transplantation and artificial pancreas development. There's ongoing research in the area of stem cells as well, but it's not yet a viable treatment option. Above all, patients can play a huge role in managing their condition through lifestyle changes, such as healthy eating, regular physical activity, and weight control. Remember, diabetes is a chronic disease, but it doesn't mean it has to control your life. With the right tools and attitude, you can lead a healthy, active, and fulfilling life.